There are a lot of things which are going on saying the COVID vaccine caused a lot of heart attacks in young people.
I want to ask you about this.
Yeah, 273 million people have asthma in India.
Okay.
And equally disturbing is that India has highest number of asthma deaths. Everyone receives few courses of antibiotic. It's totally abuse of antibiotics. There is no antibiotic for viral infection.
A lot of youngsters are taken into smoking and vaping.
Oh yes.
Doctor.
Yeah.
So, and they are not too, probably not aware of the risks involved.
So, smoking related deaths in India are second highest in the world. I'm talking about COPD.
Okay.
Chronic obstructive pulmonary disease due to smoking.
Okay.
Passive smoking also equally important. Many public are not aware of it, patients not aware. I don't smoke. But when you ask, oh, my friends smoke.
Hello, welcome to Akki Studio with me, Rithu Dravid. It's a beautiful morning and I'm here at Manipal Hospital, Millers Road, Bangalore, to interview a very renowned and famous doctor, Dr. Sathish Kadappa. He's a senior pulmonologist and the president of Karnataka Pulmonologist Association. He's often also known as a celebrity doctor. So we're here to talk to him. Welcome to the show, sir.
Thank you, Rithu. Thank you.
Yes,
it's really a nice morning, as you said.
Yes, sir. Thank you. Welcome to the show. And so you also go, doctor, you also go by the name as, celebrity doctor.
Is it?
So,
I didn't know
so how
about
do you
it.
carry this, doctor?
I didn't know about it, but it just happens when you are there for so long, practicing close to 40 years.
Right.
You tend to get all kinds of patients. I want to be known as somebody who treats common, ordinary people than a celebrity doctor, but it comes, with experience, and people know you for so long. So all walks of life, patients come and approach me for treatment and advice and so on.
Doctor. Yeah. So you've treated celebrities like Rahul Dravid, KL Rahul, late Amrish, and even the Wadiyar family at Mysore. So how does it feel to, not all can be called a celebrity doctor. So you're privileged to treat such patients because of your expertise in this field, doctor.
Yes, right.
So it's a unique feeling to have.
True. I mean, the cricketers come because I'm also into sports and I love sports. And my son is a first-class cricketer. So through that contact and also, way back in UK, I was following a lot of cricket. So I am now also the BCCI medical advisor. So for everything they contact me.
Right.
And I advise them.
Right.
And since I am into sports, I know what they go through.
Okay, so what are the things that they go through, doctor?
Mainly about, if there are medical problems, I take care. The injuries, the sports medicine people take care. But they still contact me if there is anything very specific. I deal with all the problems that they have medically, for example, respiratory infection during COVID, and if they have anything. So I take care of them. And they have been nice, the physios here, they contact me, NCA. And I happen to advise them, treat them. And way back when NCA started, we were doing screening tests for all the cricketers when they were young. So that's how the relationship, was built. That's how, see. And of course, the cine actors, film actors, one contact with another.
Correct.
Led to them contacting me. Oh, my doctor is there, and he will see, he will advise. So whatever is my field, Rithu, I will advise them. Whatever is not, but managed to send them to other doctors and manage them. So it's a nice kind of relationship that
and
we
the
have
time
developed.
that you have.
Yes, absolutely.
So you've treated countless patients over 3 decades, doctor. So there has been a lot of changing trends, right, over the years with respect to your field of pulmonology. Yes. So can you concise it and tell me what are the changing trends that you've seen over the past 3 decades? Of course, we've seen COVID, post-COVID, with a lot of different varieties of viral strains that we see. Apart from that, what are the changing trends that you've seen, doctor?
Okay, excellent question. It dates back to my training, and then I went to UK as a British Thoracic Society fellow. Okay. And worked there and did training there because not much was available then. There were a lot of respiratory physicians treating tuberculosis, but pulmonology was always expanding field that time. Correct. And we didn't have many. There were few colleges who were offering these MD degrees. So I went and did a fellowship there and it worked in UK. And when I came back, there was a lot of scope for all this, infections, respiratory. And as we grew with experience, the chest physicians are always dealing with infections, respiratory infection, pneumonia, viral infections. Then before the COVID, of course, we had a lot of influenza viruses. And then we had H1N1, in 2009, 2008, I think. And we learned a lot from that time. And I remember my very first patient who died here in Bangalore with H1N1. And that is when they said, oh, you have to quarantine, you can't come to the hospital, and we were given medicine. So we all knew when the COVID came, it wasn't so difficult initially, but later we found out that this virus is completely different, a novel virus, and what we dealt with earlier. But we were the first one to respiratory physicians all over the world and all over India, along with other physicians, because it required a mammoth number of doctors, nurses, paramedical people to jump in and get involved with the pandemic. And I don't think many would see a pandemic like this in their lifetime.
Right, doctor. And COVID has affected respiratory health a lot.
Absolutely. And so, the protocols were done. I was in the COVID committee. And then we learned a lot during COVID, not just treating patients with medicine, but many of our field forces, doctors, nurses, were also dying because it was difficult days, difficult time.
It's been a very challenging.
Very challenging, Rithu. And also mentally, psychologically,
yes,
was difficult wearing those PPE kits. And was definitely difficult. Many youngsters were roped in to do all this work. And also I saw after the COVID a lot of change in perception regarding health, regarding life itself.
So what kind of perceptions, doctor? You mean like fear-induced kind of a feeling that the patients undergo? Yeah,
not only that, everyone changed saying, oh, for example, how much we earn is not so important now. So we don't know when we are going to die.
Yeah, so the fear-induced kind of perception.
Let's enjoy life, number one, in small, yes, number one. Number two, also, let's donate, to something more. Charities were done. And there were many who were hanging on to doing the will till the last stage or not doing, but a lot of those things were done, very early, and there were some webinars conducted, who will do quickly will and things like that. So people's perspective changed of life itself, and also good things happened, like hygiene, for example. Oh, I can't spit here and there, number one.
But do you think people still follow good etiquette, sir, with respect to respiratory hygiene?
Needs a lot, no doubt about it. I keep seeing all the time people spitting.
Because all of us are off our masks. And I still see people spitting, still see people coughing, and still see people going to crowded places without masks. So is that a requirement now?
Regarding hygiene, it's always there. we have to follow that very strictly and keep doing it. It will improve in the future. Swachha Bharat is one another thing, which is driving people, I have to keep my neighborhood clean and hygiene. That definitely required for respiratory. For example, tuberculosis, spreads by droplet infection, which means when I cough, the virus or the bacteria, tuberculous bacteria, can transmit infection to anyone who is in close contact. So that's important. So what COVID taught was, one, wearing mask, as you said. It's not mandatory because it's so difficult. When everyone was doing it, was fine. You saw during COVID, everyone was wearing, even when they were walking in the park, it was not required. But still, people were using, they were, scared about it. But as you said, it's always nice to have a mask if you can, especially when you go to a crowded place, concerts, performance.
Still, doctor?
Still, no, I mean, not just for COVID.
Right.
Not
Because
just
we have other new strains, H1N1, H3N2, and I think it goes up till H11.
Yes,
right?
I mean, there will be new strains. That is the way the viruses work.
Okay.
What the viruses is survival of the fittest.
Right.
So they are very smart.
Right.
Smarter than all of us.
Right.
And
so
all
what
scientists.
role does, the vaccination play here?
I was coming to it. So
Right.
people are aware of vaccine. When respiratory physicians like I were advising annual flu vaccine, it was taken as, it's okay. I've been taking for close to 35 years now, vaccine, and I tell them I take the vaccine. Then pneumonia vaccine, which is there, to prevent serious forms of pneumonia. Now we have other vaccines, zoster vaccine and Tdap vaccine.
Is there anything specific that you recommend, doctor, for children or even for adults?
Is the flu vaccine and pneumonia vaccine. Those who are 50 and above, if they have comorbidities and like kidney disease, diabetes, high blood pressure, heart disease, cancer, chemotherapy, they must contact their doctor to get vaccinated. You may get a flu still, but it's not going to be serious forms of life-threatening disease.
Severity is reduced.
Severity is reduced, and people still ask about COVID. Is it required? Vaccine, I've taken 3, I've taken 4, is it required? So now and then the government will come up with saying, it's required, it's not mandatory. The first one and the second one and the booster was mandatory to travel and to prevent serious forms of COVID. But now there will be, some strains like Omicron, which was there. And there was a Omicron.
There were so many variants, subvariants, so many names with all these.
Yes, very important, especially in my field, because all chest physicians and in general, see a lot of tuberculosis patients. We see a lot of tuberculosis. And India is one of the top in the list for tuberculosis. Okay. We are doing a lot on tuberculosis, prevention of tuberculosis, treatment of tuberculosis. Okay. And the government is also helping patients with tuberculosis and family, giving them, for example, leave, giving them support with monetary funds because they may require some help to buy protein powder, some medicine and so on. So in that way, and all medicines are free. Can you believe all medicines?
So how many patients, TB patients do you see?
Oh, I see,
in a month?
I see
Plenty? Many?
Yeah, I mean, as respiratory physicians we see, and it's going to increase because the diagnostics have improved. And what is good about is, the expensive diagnostics, which means tests, which cost 2,000, 3,000 rupees, all free in government now. And there's a good partnership between government and private. So we are talking more with them. And
that's a good initiative.
Yeah, Rithu, for example, multi-drug resistant tuberculosis, the cost will be 50,000 to 1 lakh per month. Okay. Government provides free
of course.
for them.
Okay, that's a good initiative by the health department.
Yeah, anyone, rich and poor, it doesn't matter. So that kind of an initiatives are there. Of course, as you saw, COVID vaccines were all freely given. The flu vaccine, pneumonia vaccine hasn't happened. It's happening with HPV vaccine, you must have seen, for women. So it will happen in the future. So we also deal with, you were asking about what kind of respiratory, we also see with.
There's a lot of recent trends and patterns in even the flu
Yes.
virus. So particularly Bangalore city has seen a spike in such cases, doctor, of late. So initially the fever used to last for 5 to 7 days. Now it's spanning for over a month.
Yeah.
So parents are very worried. Children are not sent to school, and the fever, the severity, the prevalence, and the treatment takes longer than usual. So there's a lot of worry amongst parents,
Absolutely. I
children,
think
adults.
Sure, Ritu. I think I'll take this opportunity to convey this. The flu virus which is going on is called H3N2, which is the predominant virus. As you rightly said, the fever lasts for a few days, it's gone. But the after effects, for example, the cough,
Quite severe.
the respiratory, upper, lower respiratory symptoms,
Right.
and then the fatigue, listlessness, lack of sleep, those kind of things are causing problem. So a lot of patients also receive antibiotics, and they should not take antibiotics. My message here is there are
Very important message.
antivirals available. Everyone receives few courses of antibiotic. It's totally abuse of antibiotics. There is no antibiotic for viral infection. If at all patients qualify for an antiviral, that too given in the first 5 days, that's the window period. And after that, nothing they require. They require symptomatic treatment, not several courses of antibiotics. Some patients may require some decongestant, inhalers, and so on. But, they should wait for a few days till it really disappears. But it's affecting quality of life.
So how long should they wait, doctor? For example, children need to go to school. So they can't, sit at home for 5 days or 7 days without getting treated, or even, visit a doctor. So what do you recommend?
For children and others also, they are infective in the first 5 days. After that, the infection spreading period is gone, So then they may still be coughing, but they won't spread infection. But it's happening in children, all over the world. Especially after the COVID, we have seen other viruses like RSV virus, respiratory syncytial virus.
Which is quite harmful and dangerous.
In terms of, a lot of morbidity, causing a lot of cough,
Right.
distress to parents because children are not well.
So is hospitalization required in such?
Only when it's severe.
Severe.
Only when it's severe, not otherwise. I don't like to admit them unnecessary when they don't require
yes.
using hospital bed for mild problems. They can be treated at home, but it'll take some time to go. It'll take definitely. So there will be a lot of these viruses, but as chest physicians, we see also a lot of non-communicable diseases. For example, asthma, COPD, allergic rhinitis. These are our main, practice.
Are these modern lifestyle problems, doctor?
Oh yes.
COPD
Yes.
and stress-related.
Yeah.
Or even
So asthma is very common in the world, and India highest number of asthmatics in the world. 273 million people have asthma in India.
Okay.
And equally disturbing is that India has highest number of asthma deaths in the world, and many patients, many public not aware that asthma.
So what are the contributing factors, doctor, for this?
Yeah, good question. Number one is exposure to allergens. It's there all over the world. I'm not saying only India, but highest number in India, probably sheer population, geography, and so on. So one is being sensitive. You are atopic, which means you are prone for allergy. And I may be inhaling the same allergen, I may not be having asthma, but somebody else.
Environmental factors.
Yes, environmental factors, exposure to allergen, pollutants, respiratory infection, and as a child exposing to a lot of these infections could lead to, if there is a family history, all these contributes to asthma. But what is good about asthma is one, it can be prevented if there are preventable causes known, for example, house dust mite allergy, or it can be treated very well. The modern medicines are amazing. So the patients improve their quality of life, their lung function improves, and they don't get attacks of asthma. What we should all, create awareness among patients is asthma is treatable, asthma is very common, and also asthma can be dangerous. Many don't know. Many think that ischemic heart disease, cancers, and other diseases only kill people and not asthma. Oh, I cough and have congestion, nothing happens to me. I go to hospital, get some medicine. No. And there are also myths about using asthma medication, which is one hindrance in India. Is a big, I should say, block in India. That's the inhalers, which are one of the greatest discovery of last century, I keep saying, is amazing. So they cause habit forming, they contain steroids and things like that in their mind.
Yes,
so that's Ritu, we are trying to
So you're saying
improve.
It's absolutely safe.
Very
to
safe.
Be on inhalers
Very
for a long term, doctor.
Long term.
Okay.
Long term safe. You don't do any test, nothing. Long term, very safe when they require.
Okay.
Yeah.
So you spoke about asthma. So a lot of people working with the construction companies, mining and manufacturing units are exposed to a lot of hazardous chemicals, doctor. So they are prone to getting occupational asthma and other lung-related diseases, right? So what do you have to say about that?
Absolutely right. I mean, these are areas really not touched upon by all of us, everyone, because we can't go and find out what's happening to them. The environmental chemicals, pollutants are one of the major reasons. For example,
so how do we create awareness in such units?
For example, if there is a construction company owner, he should know that their employees needs protection like any other who are working laboratory.
I don't think people at these units are
You're
following
right.
these procedures of testing their patients for such hazardous.
Absolutely. The other thing also is pollution adding, and all of us know about the Delhi pollution and stubble burning causing this problem. So there are solutions, but there are also reasons, political reasons, where some of these are not implemented, and some may be interested, some may not be interested. So ultimately, across parties, across everyone, should come together, because it's the health of a particular individual, nation, community in general. Why it's important is many of us don't realize pollution, how harmful it is, since it doesn't cause acute problem like heart attack. When you get a heart pain, chest pain, you go and approach and then you're scared. Here it takes a while, it takes years to have its effect. By then it's too late. The children are exposed to, the babies are exposed to the pollutants in cities, in major cities, from childhood. And then imagine going through for 20 years, 25 years, and then at young age, 20, 25 years, their lungs are affected.
So what is the solution, doctor? I mean, we're all talking about, pollution, environmental factors, pollution, staying indoors and, inhaling, even the smoke or, molds, indoors.
Yeah.
So, I mean, what is the solution for this?
So, some of them can be prevented, as I said, creating awareness. For example, you said mold, it's due to damp wall, indoors, and things like that, house dust mite, those things.
Yeah.
But the ones which are pollution and chemicals, as you said, about the laborers and the workers who are there in the field, and also many of them farmers are exposed to the fertilizers and sprays and things like that. So we must tell them, you can't prevent them from doing, wear a mask, wear a kind of protection gears that they get. How construction workers now, we see them with a helmet. So similar ones we should be providing them. And of course, industrial workers, they should be aware of it. There are labor rules and inspectors who visit to see whether they are following certain rules. It should be strictly implemented. And the government policy also is very important, where everyone should come together across parties and say this pollution is a big problem. It's happening. You've seen the conferences and meetings of talking about environmental issues and so on. but a lot needs to be done on the ground level.
Right.
That's what is important. Creating awareness
That's very
and
important, because
implementing.
most of us have so many debates, have so many shows, talk about it, but is it really being implemented at the ground level is what we need.
So it should start from all of us, the public, that creating awareness, telling children about how environmental friendly can make their life comfortable, and how pollution can lead to all kinds of disease, not just respiratory diseases, cancers, for example, heart disease, and so on. So that's very, very important and crucial in preventing the hazards of all this environmental. And of course, smoking. We were talking about COPD. A lot of people smoke in India and especially Southeast Asia. It's coming down, but not much.
Yes,
There
a
are
lot of youngsters are taken into smoking and vaping.
Oh yes,
Doctors.
yeah.
So, and they are not too, probably not aware of the risks involved. So, what kind of awareness or strategies can be, implement at schools, colleges, workplaces?
You said it right. It should start from school.
Yes, it should.
And telling parents, and then teachers, when they speak about, they certainly have a class or something once a week or twice a week.
Have counseling sessions at schools.
In talking about, even though it's they're very small, they can show what they can understand through cartoons, for example. Showing them that the health hazards of smoking, vaping, or drugs even. So we should start as early as possible. There is nothing like, oh, they don't understand, we can't speak to them this language. We can speak to anyone in their own language, which they can understand. And it's quite important to start there, parents to be educated. And then, of course, the patients and doctors have a major role. Not necessarily respiratory physicians, but everyone about smoking. So in our department, we do a lot of quit smoking sessions, talking to patients. We are very passionate about it, being respiratory physicians, and giving them guidelines, asking them to come for follow-up. So smoking related deaths in India, second highest in the world. I'm talking about COPD, chronic obstructive pulmonary disease due to smoking. Passive smoking also equally important. Many public are not aware of it, patients not aware. I don't smoke. But when you ask, oh, my friends smoke. At home people smoke. Yeah, second-hand smoking is equally dangerous, and it can cause same health hazards. And you briefly mentioned about vaping.
Vaping, yes.
Again, WHO doesn't say that it's safe. You can do it. No, it's also, not good.
You basically inhale flavored substances.
Flavored nicotine substances. Sometimes no nicotine in that, but flavored. They may not, nicotine actually, but they may not contain carcinogens, but long-term effects. Now WHO is saying that vaping also is dangerous and bad.
Right, doctor. So, and doctor, talking about your personal life, so what made you choose the field of pulmonology to specialize in?
Okay.
You must share this with us.
The first step that all of us have is, I want to become a doctor.
Okay.
And then, then you realize that particular field suits you. Then I realized after my doing MD from Bangalore Medical College, when I came out, there were very few pulmonologists. There were, of course, TB specialists, well-known specialists. And then everyone was taking that time also cardiology, gastroenterology, neurology. They were all already in established kind of fields. So then I said, let me do something. And then I was selected to be the British Thoracic Society Fellow. So I went there, trained, I came back. There was a lot of scope for it. And when I came back, and that led me to, do this pulmonology and to do it passionately.
So what has been your most rewarding moment, doctor?
Is to see smile on my patients, and then see asthmatics, see they spot you somewhere there. Oh, you treated me, and then I'm fine now. Or you spoke to me just 10 minutes about smoking. I quit smoking, sir. Thank you so much.
So you feel nice. And people recognize you.
Yeah, so that's for every doctor.
For every doctor.
Every doctor, when he meets his patient and saying, you treated me, you delivered my child, or you did something, every doctor. And like that, they spot. So we feel so great. But also we get used to also disappointment and so on in life, not every...
Has there been any awkward situation, that you've
faced
through your...
Oh yes.
You have a lot of footfalls, I'm sure, a lot of patients that you see. So some kind of a thing that you've had with a patient,
Absolutely.
not so nice kind of a situation.
Absolutely right. Sometimes we must open up and talk. As doctors, we always have disappointments. That's why when patients tell us, you are like God to me, so we always say we're not God. We're not playing God, because we are not gods. We are also praying God every morning, make my patient get better. So you're always awkward situation in the sense I like those challenges when you communicate, when you explain to a particular patient and family that I'm sorry, I've tried my best, my team has tried best, always it's the team, and we did everything, but sorry, we can't do anything. For example, a terminal cancer patient, a respiratory failure patient, patients on ventilator, patients with, during COVID time, but those times everyone understood. There are always situations like this, but I've always taken them sportively, because when you communicate well, express and be frank and be truthful, they always come back and told me, doctor, you're the one who said, patient.
And there are very few doctors who are open to questions. So very few.
Very important. If some junior doctors are watching this, I always ask patients, you have anything to say in the last, you have any questions for me? So if you communicate, if you ask, because they may have lots of questions, and when they come to the hospital, it's not like walking to a resort or going on a holiday. They are sick. They also know that, whether they are meeting a friendly doctor, a compassionate doctor, and so on and so forth. So for us, learning is a curve, and we are learning all the time from our patients. Every day I learn from my patient. If I learn one lesson from my patient, 30 lessons in 30 days, into 12, into so many years, so you can go on calculating. So very important that we respect our patients. Rithu, important, why do they come to you? Because you're truthful. And everyone, from a villager to an illiterate to a well-qualified person will know...
confidence that you gain with your doctor.
Will know, who's good, who's not good.
Yes, doctor. And doctor, there are a lot of myths about so many misconceptions, so I want you to either confirm or quell those myths, doctor. For example, they say drinking hot water regularly on a daily basis keeps infections at bay.
So not true. I tell them, certain infections can be kept at bay. So the drinking hot water came because when there was those days, not so clean potable water was supplied. So they got used to drink, and there were no water purifiers available. So hot water, does not prevent anything, but if somebody doesn't have a purified water or a purifier, water purifier, then they can do that. Especially good for gastrointestinal infection like typhoid, for example, or hepatitis B and so on, other infections as well.
Okay, and what about the efficacy of humidifiers, doctor? Is it required for people with allergies?
I would say humidifiers, and if humidity is a big factor, yes, and some of them do get benefit out of it. Air purifiers, Rithu, is definitely one which a lot of patients used to ask 15-20 years back, but I had no answer. But I have now answer. There are some studies which have shown, especially countries like China, and Southeast Asia, in Delhi, the air purifiers have helped patients to bring down their respiratory problems and pollutants.
What about cities like Bangalore, doctor?
Definitely.
Where you see 5-6, seasonal variations in a day. So, and with the pollen
and pollutants and chemicals and so on, definitely helps. No doubt about it.
Okay. And what about, avoiding citrus fruits, cold, consuming cold foods? So do you think, those are all contributing factors to
Good question.
infection?
There can be only.
I'm sure there are a lot of people,
Yeah.
come to you with children and restrict them from eating all these things.
Ab-
The moment you say the child can have an ice cream, the child loves you. So,
Absolutely. So we generally have a very friendly and scientific, discussion about it, because there are myths again, like as you rightly said about fruits. So all fruits are good for children. Can you believe that there is a recent trial and then also a statement that children who eat more fruits are less prone for wheezing. Yeah, so fruits. There is, of course, the citrus fruits causing, acidity and things like that, can causing, but it should not be uniform kind of a.
that does not trigger an infection.
No, not infection. Forget about infection.
Okay.
No infection
Or
at
cold
all.
and cough.
Cold and cough. So allergies. So whichever community is eating or consuming more fruits, the incidence of allergy and asthma is less and wheezing is less. So this is very important, because children and others also avoid saying, no, I don't eat fruits at all because it causes cold and cough. No.
Yes.
It's in fact contrary to that.
Okay.
belief.
And another thing is, doctor, willfully bringing out phlegm. Does it cause some damage to the windpipe or the throat, food pipe? A lot of them, kind of bring it out.
I know,
just to clear the throat.
I know,
a lot of them, doing that.
So if you are thinking about like during COVID time, everyone did steaming.
Yes.
Regularly,
Yes.
which was harmful.
Okay.
We, gave statement in the newspaper.
So does that cause any damage to the lining?
It causes. It's a thermal kind of, injury, and there are reports from various centers in India showing regularly doing steam caused thermal injury. Mucous membrane is very soft.
So it wears off, is it?
Yeah, and then it burns.
Oh, okay.
Thermal injury. If you do it repeatedly every single day to prevent COVID, which was so unscientific, definitely it caused injury, because the mucous membrane is very smooth, silky,
Right. So
and
nebulization
glistening.
is okay, and
Nebulization is with medicine,
steam,
no?
right.
That's
So
okay.
steam inhalation on a regular basis is not
no.
okay.
If somebody has sinus, cough and cold, the viral infection, there you can do gargling throat and those kind of things. And as you said, some patients, keep trying to bring out the phlegm. It's not really scientific, and unless they have issues like COPD, then we only advise them, how to get rid of the phlegm, which is thick and viscid. There are various maneuvers which they can do. That's scientific, but not on a unscientific way.
Okay, doctor. So can you just give us 3 tips, doctor? 3 tips that can prevent, one from getting a respiratory infection or avoid getting a lung disease. So any 3 specific tips?
So
tips that you can.
Yeah, definitely important thing is to be aware, how it is caused. Like I told you about the infections, tuberculosis. So hygiene, very important. Not to spit anywhere you want. If you're coughing, during COVID, everyone learned how to cough. When you get a cough, you can't avoid.
Right.
So patients.
But it's all forgotten now.
It's all forgotten, absolutely. Like, you close and then you have the handkerchief, and everyone knew how to cough, and then they
if you
turn.
didn't have a handkerchief, you would
Yeah,
cough like
absolutely.
this.
Yes, that's a good thing, which we all learned and then told patients and the public to do. But it's all, as you said, forgotten. And then spitting everywhere is not a good thing, because one can have infection. If somebody is having any kind of respiratory problem, if they are coughing, then they must use a mask, wherever they are. Maybe people will feel uncomfortable, doesn't matter. So you wear a mask. Mask is one important thing. It should not be forgotten.
I saw you walk in with a mask, doctor. So
yes, I still use,
wear a mask.
when I'm seeing a patient, talking to patients,
Right.
seeing patients, that time
Correct.
I use, because it's also prevented. A lot of respiratory physicians are saying, after using the mask, we don't get sick, because we are the first line. where
Yes,
patients
the
are
close
coughing
contact
around
with your
us.
patients.
So we all felt that using mask will help. So this applies to everyone. So they should also, whenever they have any infections, they should do it. And when they feel that they are going to a huge crowd and during especially a flu season, for example, or otherwise, if they wear a mask, good. Sometimes it's impractical, but that will help. And number two, smoking, which I said, at any cost one must talk about smoking, prevention of smoking, and if they are smoking, and tell them how to quit smoking, how to stop smoking. Smoking is dangerous. And in terms of cancer, they all know about it, but it's such a addictive thing that people smoke. And then of course about vaccinations, which are there, and flu vaccine, pneumonia vaccine, herpes vaccine, HPV vaccine.
Yes.
They're all good. And of course there are a lot of things which are going on, saying the COVID vaccine caused a lot of heart attacks in young people.
I want to ask you about this.
Yeah, so it's there, but none of them proved. It's only in the lay public. Keep talking about it, sending somebody some message. They're all anti-vax people, but even ICMR came out and said it was found to be effective and safe. And everyone used it and saved millions of people.
The talk of the town is, people are at risk of getting a heart attack is
because of the heart attack is
COVID vaccines.
No,
it's just
it's just an incidental thing. It's a myth.
Okay.
Definitely, no doubt about it. It's a myth, and they are relating to various things. We are seeing those who are not vaccinated are also, dying with reasons that many a time don't know at all. About young people I'm talking about. Those who are smoking is different. Stress levels are so high. We started this discussion with lifestyle changes.
Yes, lifestyle.
Stress is one of the major contributor for all forms of disease, be neurological, be heart, respiratory, any system, diabetes, so stress is major.
So that causes sleep disorders as well, doctor. So I've been wanting to discuss with you about, the sleep apnea. Yes. So how pulmonology plays a role here?
Very important. We are the ones who treat sleep apnea, and sleep apnea is very...
Is there a silent killer? Sleep
Absolutely.
apnea? Like diabetes?
Absolutely.
Okay.
Absolutely. You said it right. Okay. So many are not aware of it. Okay. Obesity is one important reason for it, causing sleep apnea. And many don't know at all that sleep apnea can be dangerous. Okay. And sometimes you see sudden deaths in the night for patients who are obese. Reason is sleep apnea only, which causes many serious forms of disease. Many are not aware of it.
Maybe you should explain what is sleep apnea, doctor, first.
Sleep apnea is in obese individuals who have a thick neck and who generally during night, snore loudly, not mild snoring as it's common with all of us. Loud snoring at night. When they wake up in the morning, they are not fresh. During daytime, they are lazy, they are listless, and then they are drowsy, fall off to sleep. Many of them, while riding bicycle, while riding any vehicle, met with drowsy and have met with accidents with consequences. And they either have uncontrolled hypertension or hypertension requiring a lot of medication, heart disease, arrhythmias, which are irregular heartbeats and so on. And there are many other diseases which are associated with the sleep apnea. And treatment, of course, lifestyle changes, and you are getting an assessment with sleep study, and then taking an equipment called a device called CPAP machine. Okay. So it's treatable disease, and many are not aware of
this.
Right. That's sleep apnea in short.
Yeah. So that's why specifically, I wanted to know from you, doctor, about this. So thank you so much for your valuable insights, doctor. It's been a pleasure to interview here at Manipal Hospital, and we will be back with more informative content on our channel. And until then, take care and stay healthy. Thank you, doctor.
Thank you. It was nice chatting with you. Thank you.